Hello, my name is Daniel Varela, and I am the CEO of ABC Medical Center. I'm reaching out to you all today to announce some very exciting news. Starting January 6, 2020, we will be implementing our new electronic health record system at our facility. Our primary goal in implementing this tool is to improve the quality and efficiency of patient care. Although it may seem challenging for some of you to learn and adopt a whole new system, I invite you to watch this video in which I will be talking about the key functions and benefits of having our new electronic health record system. As you all know, charts contain important information such as demographic information, chief complaint, medical history, and current medications. In addition, any vitals, physician notes, physician orders, results from diagnostic tests also need to be documented in patient charts. The fact that many providers need access to a patient's chart all at one time to either review the information or to document it created a huge problem as the chart was oftentimes not available. For example, we found that providers would move on to another available patient's chart and intend to return to the original one once it became available, but many times providers would forget to come back to the chart, so documentation and orders would not be put in. Providers also had to wait for charts to be available to review diagnostic results, such as imaging in labs. This really slowed down the process and caused us to sometimes not chart or review this important information. Now that we will be implementing our new EHR, however, patients' charts will be available to several users simultaneously. That's right, no more waiting around for the chart to become available. For example, a respiratory therapist can review a patient's chest x-ray, while a nurse documents vitals and a doctor reviews a specialist's notes. We will also be able to easily share the chart and all of its information with providers outside of our facility upon the patient's request while still maintaining HIPAA compliance. This will ultimately lead to more efficiency, which will leave us with more time to provide what matters most, which is quality care. Another problem that was faced with paper charting was that providers were having difficulty understanding each other's handwriting. This caused delay in treatment as staff had to call the physician to get clarification. In some cases, it led to inaccurate interpretation of orders, which produced errors. Our new EHR system will also eliminate this problem, as all documentation and order entry will be recorded electronically and not handwritten. Not only will providers have convenient access to patients' charts, but so will patients. Patients will be able to securely access their chart wherever they are to verify that the information documented about them is accurate. They can also review things like test results, prescription medication information, immunization records, and discharge instructions all in the palm of their hand using a smartphone, tablet, or computer. This can be beneficial when, for example, a patient has to visit a doctor while they are out of town. They can easily share this information with another provider treating them. Patients will also be able to track their progress on, for example, weight and blood pressure using integrated tools such as tables and graphs, which may help engage patients in improving their health. Another benefit that patients will have is the ability to communicate via SMS messaging with their providers. With the ability to easily search information online, more and more people are using the internet to perform research about medical concerns they may have. The problem is that much of the information out there is not backed by evidence and can be based on conspiracies. Our patients can be vulnerable to becoming misinformed and therefore may self-diagnose and self-treat an error based on a Google search. Our new system will allow us to share accurate information on our webpage that is based on evidence and reviewed by physicians or organizations such as Red Cross and the Center for Disease Control. For example, we can post information and resources about smoking cessation counseling, vaccines, and how to be compliant with medications. Other good examples are posting information on how to avoid getting a cold, recent outbreaks. The list can go on and on about the valuable and accurate information that we can post. In addition, we can also share these posts on social media so that we can really involve and inform our community. The community will be able to discuss and ask questions about the posts, and we will have designated providers available to reply to people's questions. Our associated outpatient clinics will also benefit from our new EHR. In addition to the advantages mentioned earlier, our outpatient clinics will have additional software. The software will allow patients to go online, view hours of operation, view available appointment times, and be able to schedule their own appointment. On arrival to their appointment, they will no longer be using paper to update information. They will now be using a tablet to do so. The software on the tablet will facilitate data entry by the patient by drop-down menus, checkboxes, and illustrative anatomy models to help patients describe, for example, which area they are experiencing pain. Once the patient finishes the form, the information will be submitted directly into our EHR for our review. This will also make our process more efficient and improve the patient's experience, as they will no longer have to repeat information to several providers. Now, I know all of you may be wondering about how difficult it may be to learn to use this new system. Although there will be a learning curve, we will be providing professional training during your work days that will provide you with all the knowledge and confidence to use this valuable and powerful tool. With that being said, I hope that you are all excited to be empowered with this new tool that will help us to improve the quality of our care with patients. This concludes this video. Thank you all for your time.